It's the one. Am I audible to all of you? Uh, Good afternoon, all of you. Welcome you all here today afternoon on behalf of SNA Group of Institution. First of all, I would like to give a short introduction about SNA. SNA is a Society for Nature, Education and Health, which was registered in 2002, whose vision is to bring change in the lives of vulnerable and marginal people in society. Under this roof of SNA, we run three institutions: Center for Bioinformatics, Polytechnic College. Next is Santos College of Teachers Training and Education. And third one is the Snekul Public High School. Welcome you all on behalf of our founder and chairperson, Dr. Rasmi of the three institutions, our deputy director, Dr. Aditi, all principals, and our faculty members. Before taking this afternoon ahead, let me take the opportunity to introduce myself. I am Kumar Vishal, Principal, Center for Bioinformatics, Polytechnic College. Presently, we are facing corona epidemic and it has changed a lot in various phases of life. We teachers and parents both are worried that how we will return to our normal lifestyle. Today, we have arranged this webinar regarding the precautions we have to take while our classes will start. Connecting to this context, we have invited Dr. Anuj, who is a consultant maxillofacial surgeon, MEDICA Hospital, Ranchi. Welcome you, sir. So again, it's a great indeed privilege to have our speaker, Dr. Anuj Kumar, who is a renowned name in the field of craniofacial surgery and facial aesthetic in Eastern India. He's a consultant to Bhagwan Mahavir Medica Super Specialty Hospital, Ranchi. He has served as Honorable Treasurer and Joint Secretary of the Association of Oral and Maxillofacial Surgeon of India. Currently, he is the state representative to National Executive Committee of AOMSI. He is also a core committee member of Facial Injector Society. With 10 national and international publications, Dr. Anuj has a special interest in the field of maxillofacial trauma. Dr. Anuj is founder of DG Ray, which is the first CBCT center of Jharkhand. Dr. Anuj is also the course mentor for surgical educational and training program for mental practitioner in the field of maxillofacial surgery. Now I would like to share this virtual platform. Welcome you, sir, Dr. Anu, sir. We can next platform will be continued by Dr. Anuj. Welcome you, sir. Sir, you can unmute yourself.
A very good afternoon to everyone. I would welcome you all for this webinar on resuming classes amidst COVID. We'll be discussing various aspects of COVID, and we'll mainly focus on how to prevent transmission of COVID in colleges and what should be the SOPs while we resume the classes. Now I will share the PowerPoint presentation. In a very straightforward statement, Dr. R. Krech, who is the Director of Health Promotion in World Health Organization, told that schools can reopen safely. He further added that decisions to reopen school should be driven by data and the safety measures in place, but he also addresses that the concerns of students, parents, caregivers, and teachers must be taken into account. These concerns are best addressed if reopening approaches are co-designed with students, parents, caregivers, and teachers. Now, taking a brief introduction to COVID, it is a disease caused by a new strain of the virus. CO stands for corona, VI stands for virus, and D for disease. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome and some type of common cold. Common symptoms are fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties, and in rare cases, the disease can be fatal. Now, since these symptoms are similar to flu or the common cold, testing is required to confirm if someone has COVID-19 or not. The virus is transmitted through direct contact with the respiratory droplets of infected person, which is mainly generated through coughing and sneezing. Individuals can also be infected from and touching surfaces which are contaminated with the virus and touching their faces, especially eyes, nose, and mouth. COVID-19 virus may survive on surface for several hours, but simple disinfectants can kill it. Older people, especially those with chronic medical conditions like diabetes, heart disease, are at more risk of developing severe symptoms. And relatively fewer cases have been reported amongst children. The definitive treatment is not yet conclusive. Several clinical trials are being conducted to evaluate the efficacy of various treatment, and even various vaccines are under trial at present. Now, as with any other respiratory infection like the flu or the common cold, public health measures are critical to slow the spread of illness. These main prevention actions are staying home when sick, covering mouth and nose with flexed elbows or tissue when coughing and sneezing, and those tissues must be disposed immediately, washing hand often with soap and water, and cleaning frequently touch surfaces and objects. Now, coming to reopening of colleges and schools, there are basic principles that can help keep students, teachers, and staff safe at college and help stop the spread of these disease. The recommendation as per the WHO and UNICEF for healthy colleges are, uh, are the following. First and foremost, sick students, teachers, and college and other staff should not come to colleges. College must reinforce regular hand washing with safe water and soap, alcohol rub, hand sanitizer, or chlorine solutions, and at a minimum, daily disinfection and cleaning of surfaces. It's a duty of college to set up a college support team which is appropriate to the local context, which may compose of teachers, college administrators, students, and parents or caregivers to assess the feasibility of implementing protective measures before college reopens based on the recommendation of national and sub-national or local authorities. The college support team should revise personal and attendance policies, and they should review the feasibility of implementing physical distancing in and outside classrooms. College administrator and teachers should ensure adequate ventilation using natural ventilation in classroom, canteens, and other rooms. Colleges should provide water, sanitation, and waste management facilities and follow environmental cleaning and decontamination procedures. Colleges should promote social distancing, which is a generic term applied to certain actions that are taken to slow down the spread of highly contagious disease, including limiting large number of people coming together. College authorities should stay informed about COVID-19 through reputable sources such as UNICEF, WHO, and National Health Ministry advisories. We must be cautious and be aware of fake information that may circulate by word of mouth or online. College authorities should work along with the government officials to guarantee that colleges are not used as shelters or treatment units, should consider canceling any community event meeting that usually takes place on college premises based on risk, should reinforce frequent hand washing and sanitation and procure needed supplies. Moreover, to prepare and maintain hand washing stations with soap and water, and if possible, place alcohol based hand rub in each classroom, at entrance and exits, and near lunchrooms and toilets. To clean and disinfect the college building, classroom, and especially water and sanitation facility at least once a day, particularly those surfaces that are touched by many people, like railings, lunch table, sports equipment, doors and windows handles, teaching and learning aids. For cleaning, sodium hypochlorite at 0.5% for disinfecting surfaces, and 70% ethyl alcohol for disinfection of small items should be used. Social distancing practices, which may include, first and foremost, staggering the beginning and end of the college's days, like so that the crowd is not accumulated at the beginning, because most probably the beginning and the end are the most common time when most of the people come together. So they should stagger as per the class so that the people don't come together. Any assemblies, sports game, and other events that can create crowd should be avoided. Whenever possible, students' desks should be at least 1 meter apart, and unnecessary touching should be avoided. The college authority should establish procedures if student or staff becomes unwell, plan ahead with local health authorities, school health staff or college health staff, and update emergency contact list. They should ensure a procedure for separating sick students and staff from those who are well without creating stigma. That is most important, and minimize the disease. And the process for informing the parents or caregivers and consulting with healthcare providers or health authorities wherever possible. Students or staff may need to be referred directly to the health facility depending upon the situation or context, or they can be sent back home. All the procedures, all the SOPs must be shared with staff, parents, and students ahead of time so that they are well aware of all the SOPs which is in practice. They should share known information with staff, caregivers, and students, providing updated information on the disease situation, including prevention and control effort at colleges. They should reinforce that caregivers should alert the college and healthcare authorities if someone in their home has been diagnosed with COVID-19 and keep their children at home. They should utilize the parent-teacher committee and other mechanisms to promote information sharing. Also, be sure to address students' questions and concerns, including through the development of student-friendly materials such as posters, which can be placed on notice boards, in restrooms, and other central locations. College authorities should develop flexible attendance and sick leave policies so that they encourage students and staff to stay home when sick or when they are caring for sick family members. Discourage the use of perfect attendance awards and incentives. They should identify critical job functions and positions and plan beforehand for alternative coverage by cross-training the staffs. Plan for possible academic calendar changes, particularly in relation to breaks and exams. Monitor school attendance, implement school absenteeism monitoring system to track students and staff absence and compare against usual absenteeism pattern at the school. Local authorities must be alerted if there is a large increase in student and staff absenteeism due to respiratory illness. Plan for continuity of learning in such cases where sick leaves or temporary school closure, and to plan to support continued access to quality education. These measures can be use of online or e-learning strategies, assigning reading and exercises for home study, radio or podcast or television broadcast of academic content, assigning teachers to conduct remote daily or weekly follow-up with students, and to review and develop accelerated education strategies, implementing targeted health education, integrate disease prevention and control in daily activities and lessons. They should ensure that content is age, gender, ethnicity, and disability responsive, and activities are built into existing subjects. College authorities should address mental health or psychological support need. They should encourage students to discuss their questions and concerns. It is important to explain to the students that it is normal that they may experience different reactions, and encourage them to talk to teachers if they have any questions or concerns. To guide students on how to support their fellow students and peers and prevent exclusion and bullying for those students who are suffering or who are showing symptoms of COVID-19. All the teachers must be aware of local resources for their own well-being. They should work with college health workers and social workers to identify and support students and staff who exhibit signs of distress. Apart from the role of teachers and college authorities, the role of parents or caregivers and community members is equally important. It is important to monitor their child's health and keep them home if they are ill. Teach and model good hygiene practice for your children. Wash your hands regularly with soap and water frequently. If soap and water are not readily available, use of an alcohol-based sanitizer with at least 60 to 70% of alcohol should be used. Wash hands with soap and water if hands are visibly dirty. Ensure that safe drinking water is available and toilets are clean and available at home. They should ensure that the waste is safely collected, stored, and disposed of. Again, they should practice hand hygiene like sneezing into the tissue or your flexed elbow, and avoid touching your face, eyes, mouth, and nose. Parents must encourage their children to ask questions and express their feelings with them or their teachers. Parents must remember that their child may have different reaction to stress, so they must learn to be patient and understanding. Prevent stigma by using facts and reminding students to be considerate of one another, and parents must coordinate with the college to receive information and ask how they can support the college safety efforts through parent teacher committee. Similarly, there are a few checklists for students and children. In these situations, it is normal to feel sad worried, confused, scared, or angry. So the child must know that they are not alone. They can talk to someone they trust, like their parents or teachers, who can help them to keep them and their school safe and healthy. Don't hesitate to ask questions. Don't hesitate to educate themselves and get information from reliable sources. They should wash their hands frequently with soap and water for at least 20 seconds. It is very important to not share cups, eating utensils, food, or drink with others. Students must try to be a leader in keeping themselves, their colleges or schools, family, and community healthy. They should share what they learn about preventing disease with their family and friends, especially with younger children. They should model good hand hygiene practice. They should not stigmatize their fears and teach anyone about being sick. And always remember that virus does not follow geographical boundaries, ethnicity, age, or ability or gender. Tell their parents or another family members or a caregiver if they feel sick and ask to stay home. So, what are the take home messages? First and foremost, hand hygiene and respiratory etiquettes are important. Physical distancing is important. The use of mask in colleges and schools should be promoted, should be mandatory. Environmental cleaning and ventilation is important, and respecting procedures for isolation of all people with symptoms are important. And most importantly, stay at home if you are unwell. Now, these are the suggested read mostly from the website of World Health Organization or UNICEF, where they have listed down the complete checklist to support the schools to reopen and prepare for COVID-19 resurgences, and giving tips to teachers and college authorities for classroom precautions. For any concerns, you can always reach to me.
Thank you, sir.
Do we have any questions?
Uh, Actually, sir, these all precautions are very necessary, and you have just shared a lot of informations. Sir, I would like that if you would share the PPT so that you can place it in the website. Uh,
Sure. I'll do that, sir.
yes, sir. Uh, yes, it was very interesting, very informative. I would uh, like to express our
Yes,
profound.
I have a question from Dr. Anuj. Hi, hello, doctor. This is
Hi.
Aditi. I'm the deputy director here.
Yes, please
I
tell me now.
was just wondering. So we have taken some few precautions because there are certain, like, there has been some entry and entrant because of the students because of different activities.
Okay.
I was just wondering, like, are there any machines or stuff which we should get, like, in order to a scanner or something, or a normal scanning of temperature and all is like good enough?
Ma'am, see, the regular scanner, what we are using, infrared thermometer, that will just detect the fever. So right now, apart from RT-PCR, the diagnostic
Yeah,
test, we
yeah.
don't have any other test which will definitely diagnose a patient with COVID-19.
Okay.
Yes, for screening purpose, it is always better to have a infrared thermometer and a pulse oximeter. In these things can be kept handy in schools, so that for emergency these can be used just to screen out the patients. You cannot diagnose, but you can at least screen out the patients.
And I just wanted to also know that so we have a school where there are younger kids, and we have
Okay.
colleges where the older kids come in. So as of now,
Okay.
like, as the situation prevails, I don't think so. The schools for the younger kids would start anytime
Yes.
soon.
Yes.
But as the the government keeps placing the notices about the older kids coming to school, or maybe the college restarting. So because as such, if you see like the campus, we have enough space for like social. So how do we work on this? Like we just were wanting to take your information and input as per the admin per se, that should we divide the class, because we might have like say 100 students in a batch. So
Okay.
how advisable it is to have all 100 in a, although the halls and things are big enough, but do we divide it, do we alternate it? I mean, how many, what should be the percentage of attendance if there is like 100 student per batch?
Ma'am, there are two basic things. First of all the halls, or wherever you are teaching, all the labs, they should be well ventilated.
Mhm.
Okay, it is always better to have a natural ventilation. In case there is no natural ventilation, then those air conditioners which exchange the air, that can be used. The classroom should be big enough that between each desk there is at least a 1 meter of gap. That is a universal precautions which they are asking the school and colleges to take, that there should be at least a uh, 1 meter gap between the desks. So if your hall is is large enough that it can accommodate 100 students with 1 meter of gap between each desk, it's fair enough. Otherwise it is always advisable to divide the classes.
All right.
Another what can be done is to have lunch timing different for different classes. That lunch timing should not be uniform for everyone. For maybe for if you have 10 classes, for two classes it is, how it is in banks, right? For few workers it is from 12 to 12:30. For four workers it is 12:30 to 1 o'clock. Like that it can be done.
Okay.
So these two can be implemented, but your classroom should be large enough to accommodate all the students with at least 1 meter of gap between the desks.
And what about the hostel facilities? So there will be students, because we do have hostel in-house hostel facilities, and once the
Okay.
students start coming back, what are the precautions we should take in there?
Ma'am, it is always no for student. I'm not sure if your hostel, they have sufficient space that these social distancing can be implemented. If it is the most important thing is to teach the students. Like it is not feasible to keep check on each and every student personally. So what can be done is to teach the students to mention social distancing. They should not, share utensils, share food, share drinks. They should avoid sharing this, first of all. Second, if any of the student is unwell, if they are having any kind of such symptom, it is always better to send them back home. And a few of the basic things, like regular checking of temperature. There should be a warden who should regularly assess all the children who have any kind of symptom, especially cough, sneezing, loss of smell, loss of taste. These are the cardinal signs and symptoms. So it is very important that there should be someone who should regularly assess all these symptoms in each of the students. So depends upon how much the strength of the hostel. And most importantly, if you are planning to open the hostel, it is very important to teach the students to educate them on how to self-diagnose and how to maintain social distancing. It will be very difficult to individually monitor these things. So the best thing is to teach students themselves, and all you can do is to ensure that there is a sufficient hand sanitation space, to ensure that all these things are procured. And someone who can regularly assess their temperature, like everyone should if there is a mess, anyone going for the mess, they should screen the temperature, they should screen the pulse oximeter. Those things can be done.
And one last question I have.
Yes, ma'am.
So, supposedly, once the college starts functioning, or even the hostel for that matter, and if there is any positive case which comes during the running of the college, maybe in faculties or the students, so is it then that do we shut the institution for a few days, get it sanitized, or do we keep, like, so like I just want to understand that once this start functioning, and as the vaccines, I don't know when and where will it be
Mhm.
available to the
Mm.
normal public. So what if there are positive case coming in? Should we again shut down, or should we kind of, what can be the ways that we can manage at our
Yeah,
level?
for that there is a definitive guideline. All colleges, as per WHO, or as I was telling, that they have been asked to compose a college, or there's a committee where they are representative from the school and from the parents and from students. Now, the work of that committee will be to inform the health authorities in case any such COVID positive patient is diagnosed in the premises. Second thing, if if there is a patient is diagnosed, there should be a contact tracing. And as per recently, that particular class can be suspended. All people who have come in contact should be tested, and sanitization should be done for that particular class. It is right now it is not recommended to completely shut down the whole campus.
Mm-hmm.
So if for example, if in a particular class a person or a student has been detected COVID positive, the contact tracing should be done. His close friends, the with whom he has interacted for the maximum time, they should be tested. The class should be suspended for 3-4 days. That particular class, sanitation can be done for that particular class, and then as per the report, it can be carried on. It is not mandatory to shut down the complete college campus if a student or teachers comes positive.
Okay. So I think for time being, I think we are good. And thank you for all your time.
Welcome, ma'am.
Vishal sir,
Yes,
now
sir.
you can take over, please.
Yes, yes. Thank you, sir. And
Thanks.
your informations are very grateful and very helpful for us,
Thank you.
because the things, when the things will run out normally, we have to take care of this, each and every point
Definitely,
you
definitely,
just shared with us.
definitely.
And uh, maybe more questions arise at that time. We don't know that how to.
Sure, sure,
Yeah.
sure.
So, sir,
I'll be just a call away.
okay, okay. Definitely, sir. We will contact you. And
Definitely.
it was a very nice webinar. You shared a lot information to us and to
Thank
our
you so much.
friends also. Would like to express our profound gratitude for
Thank,
taking out your busy schedule for us and enlighten us with your knowledge. Thank you so much, sir. I would like
thank you
to
so much,
thank
sir.
our director, ma'am, our deputy director, Aditi, ma'am, for giving us the chance to organize this seminar, which was very fruitful. And thank you, all faculty members, staff members, and students to make it a successful. Once again, thank you, sir. Thank you being with us. Thank you very much, sir.
Thank you, sir. Thank you.